Painful urination is something most men don't talk about, but it can be an early warning sign that something important is happening in the urinary tract. Whether it's a burning sensation, a sharp discomfort, or a dull ache while passing urine, these symptoms should never be ignored, especially after the age of 50. In younger men, painful urination is often linked to temporary infections or irritation. But in older adults, the causes can be more complex, sometimes involving the bladder, prostate, or kidneys. And because urinary symptoms can overlap, it's easy to miss the real issue if we don't understand the possible causes clearly. In this video, we'll break down the 5 most common causes of painful micturition in adult men, especially those over 50. We'll keep the language simple so you can fully understand what's going on in your body. We'll also discuss practical lifestyle habits and preventive steps that can reduce risk, protect your urinary system, and help you seek the right medical attention when needed. Painful urination is not just uncomfortable, it's your body's way of signaling that something may need medical attention. For some men, it's a sign of infection, while in others, it may be related to enlarged prostate, bladder stones, or even more serious conditions if left unchecked. If you're over 50, your urinary tract and prostate undergo natural changes with age. This can make you more prone to irritation, retention, and infection. The good news is, understanding these changes early and taking preventive action can make a huge difference. So let's explore these causes one by one, so you can take control of your health confidently. One of the most common causes of painful urination in adult men, especially after the age of 50, is a urinary tract infection, often called a UTI. While UTIs are more common in women, they can still affect men, particularly when there are other underlying issues like prostate enlargement or incomplete bladder emptying. A UTI happens when bacteria enter the urinary tract and begin to multiply. In men over 50, this often occurs because the bladder doesn't empty completely, giving bacteria a chance to grow in the remaining urine. The most common bacteria involved is E. coli, which normally lives in the intestines but can cause infection when it reaches the urinary system. The symptoms can range from a burning sensation during urination, a frequent urge to urinate and lower abdominal discomfort, to cloudy or foul-smelling urine. In more serious infections, fever or chills may develop, which could indicate the infection is spreading to the kidneys or prostate. Men over 50 have additional risk factors. As the prostate enlarges, it can obstruct urine flow, causing retention. This creates a warm, moist environment inside the bladder, the perfect setting for bacteria to thrive. Conditions like diabetes, which is more common in older adults, can also weaken the body's immune defenses, making infections more frequent and harder to clear. If untreated, a simple UTI can become complicated and lead to prostatitis, kidney infections, or even sepsis in severe cases. That's why it's so important to pay attention to symptoms early, rather than ignoring them. The good news is that UTIs are usually treatable with the right antibiotics, and they respond well if caught early. Preventive measures, such as staying hydrated, emptying the bladder fully, and maintaining good hygiene, can lower the risk. For men with enlarged prostates, managing that underlying issue can also reduce recurrence. Painful urination should never be dismissed as just part of aging. When it's due to infection, prompt attention can prevent bigger problems and protect both the bladder and kidneys in the long run. Another important cause of painful urination in adult men, especially after the age of 50, is prostatitis, which simply means inflammation of the prostate gland. This condition can be acute, developing suddenly due to infection, or chronic, persisting for weeks or even months. Both types can cause significant urinary discomfort. The prostate gland sits just below the bladder and surrounds the urethra, the tube that carries urine out of the body. When the prostate becomes swollen or inflamed, it can squeeze this tube, making urination painful, slow, or difficult. This pressure often leads to a burning sensation during urination, frequent urges to urinate, or a feeling that the bladder isn't fully emptying. Some men also experience pain in the lower back, groin, or perineal area, the space between the scrotum and the anus. In acute prostatitis, the inflammation is usually caused by a bacterial infection, often the same bacteria that cause urinary tract infections. Symptoms tend to appear quickly and may include fever, chills, body aches, and a sudden onset of pain while urinating. This form requires prompt medical attention and usually responds well to antibiotics. Chronic prostatitis, on the other hand, can be more challenging. In many cases, the exact cause isn't clear. It may be related to low-grade infection, inflammation without infection, or even nerve and muscle dysfunction in the pelvic region. Symptoms may come and go, but the discomfort can be persistent and affect quality of life. Men over 50 are more prone to prostatitis for several reasons. Age-related changes in the prostate, decreased immune response, and urinary retention from an enlarged prostate can all increase susceptibility. In some cases, previous untreated UTIs may seed bacteria into the prostate, leading to recurrent inflammation. Treating prostatitis depends on the cause. Acute bacterial prostatitis usually improves with targeted antibiotics, hydration, and rest. Chronic cases may need a combination of medications, pelvic floor therapy, or lifestyle changes to reduce inflammation and muscle tension. The key message is simple. Painful urination in older men should always raise the possibility of prostatitis. Ignoring it can lead to complications like abscess formation, chronic pelvic pain, or recurrent infections. Early diagnosis and appropriate treatment can bring significant relief and protect long-term prostate health. Of the most frequent underlying causes of painful urination in men over 50 is benign prostatic hyperplasia, often called BPH or simply an enlarged prostate. This is a non-cancerous growth of the prostate gland that happens naturally as men age. By age 50, about half of all men experience some degree of prostate enlargement, and by age 70, this number climbs even higher. The prostate sits directly below the bladder and wraps around the urethra, the tube that carries urine out of the body. As the prostate slowly enlarges, it begins to press on the urethra, much like squeezing a garden hose. This narrowing makes it harder for urine to flow freely, leading to straining, weak stream, and incomplete bladder emptying. Over time, this back pressure can irritate the bladder lining, making urination uncomfortable or even painful. Men with BPH often describe a burning or stinging sensation during urination, especially at the start or end of the stream. There may also be increased frequency, especially at night, urgency, or dribbling afterward. In some cases, pain is not from infection but from mechanical pressure, inflammation, or secondary bladder irritation caused by the obstruction itself. Another important point is that incomplete bladder emptying increases the risk of secondary infections. Stagnant urine provides a perfect environment for bacteria to grow, which can lead to urinary tract infections or even prostatitis, both of which further worsen painful urination. Factors that accelerate BPH include hormonal changes with age, particularly the action of dihydrotestosterone, or DHT, a hormone that stimulates prostate tissue growth. Genetics, lifestyle, and metabolic factors like obesity and diabetes can also play a role. Managing BPH involves several options depending on severity. Mild cases may respond well to lifestyle changes, such as reducing evening fluid intake, avoiding caffeine and alcohol, and timed voiding. Medications like alpha blockers and 5-alpha reductase inhibitors can relax the prostate and shrink it over time. In more advanced cases, minimally invasive or surgical procedures may be needed to relieve obstruction. The key takeaway is that BPH is extremely common after 50, and painful urination may not always mean infection. Sometimes it's simply the result of the prostate squeezing the urethra. Recognizing this distinction helps in choosing the right treatment and avoiding unnecessary antibiotics. Regular checkups, early detection, and proactive management can make a huge difference in quality of life. Another significant cause of painful urination in adult men, particularly those over 50, is the presence of bladder or kidney stones. These are hard, crystal-like deposits that form when minerals and salts in the urine become concentrated and stick together. While stones can develop in any part of the urinary tract, their presence in the bladder or lower urinary tract often leads to painful symptoms during urination. Stones can range in size from a grain of sand to several centimeters across. Small stones may pass through the urinary tract unnoticed, but larger stones can irritate the delicate lining of the bladder or urethra, causing sharp, burning pain while urinating. Sometimes this pain is felt at the tip of the penis or deep in the lower abdomen. Men may also notice blood in the urine, frequent urges to urinate, or a sudden stop-and-start flow as the stone shifts position. In men over 50, bladder stones are often secondary to other conditions, particularly BPH, which can cause incomplete bladder emptying. When urine remains in the bladder for extended periods, minerals like calcium and uric acid settle and crystallize, eventually forming stones. Dehydration is another major contributor. Concentrated urine makes stone formation more likely. Kidney stones, on the other hand, may start higher up in the urinary system and travel down into the bladder. As they move, they can cause severe flank pain, known as renal colic, which may radiate to the lower abdomen or groin. Once the stone reaches the bladder or urethra, painful urination often follows. Some stones can also act like a ball valve, temporarily blocking the flow of urine and causing sudden interruptions during urination. This can lead to intense discomfort and increased pressure inside the bladder. Diagnosing stones usually involves imaging studies like ultrasound or CT scan, along with urine tests to check for blood or infection. Treatment depends on the size and location of the stone. Smaller stones may pass naturally with increased hydration and pain control, while larger ones may require medical procedures like cystoscopy or lithotripsy to break them up. Preventing stones involves staying well hydrated, maintaining a balanced diet, and treating underlying conditions such as prostate enlargement. For older men, regular bladder emptying and managing urinary retention can significantly lower the risk. In short, stones irritate and physically damage the urinary tract, making urination painful. Recognizing the symptoms early can prevent complications and protect kidney and bladder health. The fifth major cause of painful urination in adult men, especially those over 50, is urethral stricture, which refers to a narrowing or scarring of the urethra, the tube that carries urine from the bladder out of the body. Although less common than infections or prostate enlargement, strictures can significantly affect urinary flow and comfort. A stricture usually develops when the urethral tissue becomes damaged and heals with fibrous scar tissue, which does not stretch like normal tissue. This scar tissue causes the urethra to narrow, leading to difficulty starting urination, weak stream, dribbling, and pain as urine pushes through the narrowed area. Men may describe a burning or sharp pain during urination, or a sensation that urine flow is being forced through a tight space. There are several reasons why strictures develop. Past infections, particularly sexually transmitted infections like gonorrhea or chlamydia, can cause inflammation and scarring. In older men, previous catheter use, prostate surgeries, or medical procedures involving the urinary tract can also leave behind scar tissue. Trauma to the pelvic area even years earlier can sometimes result in delayed stricture formation. Over time, this narrowing can make it harder to completely empty the bladder. Stagnant urine then increases the risk of repeated infections, bladder stones, and worsening discomfort. Some men may experience urinary retention, where very little urine comes out despite strong urges, which can be both painful and dangerous. Urethral strictures are more common in older adults, partly because they may have undergone more medical interventions, and also because tissues naturally become less elastic with age. The condition often develops slowly, so symptoms may be subtle at first. But as the narrowing progresses, painful urination becomes more noticeable. Diagnosis typically involves uroflow studies, where doctors measure the speed and pattern of urine flow, along with imaging tests or cystoscopy to visualize the narrowed area. Treatment depends on the length and severity of the stricture. Mild cases may be managed with dilation, a procedure that gently widens the urethra. More significant strictures may need surgical correction to restore normal flow. Addressing strictures not only relieves pain, but also prevents long-term complications like chronic infections and kidney damage. The key point is that painful urination isn't always caused by infection. Structural problems like strictures can mimic those symptoms but require a different approach. Recognizing this cause is essential for proper treatment, especially in older men who may have complex urinary histories. Maintaining good urinary health after 50 is not just about treating problems as they arise, it's about preventing them from developing in the first place. As men age, changes in the prostate, bladder function, and immune system can make the urinary tract more vulnerable. However, with smart lifestyle choices, many cases of painful urination can be avoided or at least reduced in severity. The first and most important step is staying properly hydrated. Many older men intentionally drink less water to avoid frequent trips to the bathroom. Unfortunately, this can make urine more concentrated, which irritates the urinary tract and increases the risk of infection and stone formation. Aim for a steady intake of water throughout the day. Not excessive, but enough to keep urine pale yellow. Good urinary hygiene and bladder habits also play a key role. Always empty the bladder fully when urinating and never hold it in for long periods. Chronic retention of urine allows bacteria to multiply, increasing infection risk. After bowel movements, proper cleaning helps prevent bacteria from traveling toward the urinary tract. For men, regular prostate checkups are important to detect early signs of enlargement or other changes. Next, focus on a balanced, anti-inflammatory diet. A diet rich in fresh fruits, vegetables, whole grains, and healthy fats supports immune health and reduces inflammation in the urinary tract. Limiting excessive red meat, processed foods, sugary drinks, and alcohol helps reduce bladder irritation. Some foods, like cranberries, pomegranate, and green tea, have natural antioxidant and urinary protective properties. Additionally, nutrients like zinc, vitamin D, and omega-3 fatty acids support prostate and urinary health. Physical activity is another underrated but powerful preventive tool. Regular exercise improves circulation to the pelvic organs, strengthens bladder muscles, and supports immune function. Activities like walking, swimming, light resistance training, and pelvic floor exercises can help maintain healthy urinary control. It's also important to avoid unnecessary catheter use and to follow safe practices during medical procedures. Repeated catheterizations or poorly handled instruments can increase the risk of urethral trauma and future strictures. Sexual health matters too. Practicing safe sex, using protection, and getting prompt treatment for sexually transmitted infections can prevent urethral inflammation and scarring later in life. Even though some STIs may seem mild, untreated infections can cause lasting damage that leads to painful urination years later. Finally, regular medical checkups are essential. Men over 50 should not ignore subtle urinary changes, even if they seem minor. Early detection of prostate enlargement, infections, or structural issues often leads to simpler, more effective treatments. In short, hydration, hygiene, nutrition, physical activity, and regular checkups form the foundation of prevention. By making these part of daily life, men can significantly lower their risk of painful urination and maintain better urinary health well into older age. Painful urination in adult men, especially after the age of 50, should never be ignored. While infections are common, the causes can range from prostate enlargement and bladder stones to structural changes like urethral strictures. The key is to pay attention early, understand your body, and seek timely medical advice. Remember, early action often prevents bigger problems down the road. Simple lifestyle habits, like staying well hydrated, eating a balanced diet, staying physically active, and scheduling regular checkups, go a long way toward keeping your urinary system healthy and pain-free. If you've been experiencing burning, discomfort, or difficulty while urinating, don't wait it out. Talk to your healthcare provider. Addressing issues early can help avoid chronic complications and improve your quality of life. For more science-based, easy-to-understand health content like this, make sure to follow and turn on notifications so you don't miss our upcoming videos, including special episodes for women and advanced tips for prostate health. Take charge of your health today. Your future self will thank you for it.